So, hi guys, Alicia So Awesome. So like 9 years ago, right? I was in nursing school 9 years ago because I'm 7 years in. Okay. So like 9 years ago, I'm out and I'm having breakfast with my guy and I'm out of clinical and I'm in my scrubs. And the lady serving us was trying to get a nursing school. And she's like, so how's the program? Like, I've been trying to get in. And I'm like, it's hard, right? I'm a single parent. I'm raising a child. I'm in the program. You have classes when you get in the program on top of clinical, and your professors, clinical professors and professors in the classroom want you to be successful at all things, right? And she was very angry with me. So when I get in the car, I'm talking to my guy and he's like, she was looking like you discouraged her when you told her it was hard. Nursing school is hard. And I want to be clear because sometimes I feel like people think it's a walk in the park. You are in charge of saving somebody's whole life, right? If you're going into the bedside, you are the first eyes on the patient. As a nurse practitioner, I'm hard on my nurses. I need to know what you see, right? I need you to tell me what's going on. I can't be there as much as you're there. What's going on with the patient? I need your assessment skills to be sharp. When I say it's hard, it's not to discourage. It's to encourage you to bust your ass, and you have to study hard. You fall asleep with your books on your lap. You wake up with your books on your lap. You know, you flipping through flashcards while you're hanging out with your friends, right? Like you just want to go through a couple of flashcards before you get there. You go through them before you go home. It is as if your life depends on it, and it does. It's your future. And I think that when I'm talking to people about their endeavors, like yesterday I was at Emory and I was talking to some nurses who want to go back to school one wants to be a CRNA and one wants to be a nurse practitioner. And they're like, but it's hard. Guys, like it's going to be difficult. If you prepare yourself, if you study, if you dedicate the time, you will be successful. If you're not willing to dedicate the time or the energy, this is probably not for you. But you've got to dedicate the time and the energy, right, in order to be successful. That's just what it is. You are in charge of saving a whole life. If you're a nurse coming out of nursing school with your bachelor's degree, associate's degree, you are the first eyes on the patient. The providers, me, the MP, I'm on you. I need to know what's going on. What do you see? You say he's short of breath. What was he doing before he got short of breath? Let me know, right? As a nurse practitioner, you are the one in charge of making sure the patient has everything they need. If the patient is going down, what are you going to do? You got to put an adequate plan into play. These are not easy decisions to make. CRNAs, right? They are putting the patients to sleep before they get their surgeries and waking them up. You got to make sure you're giving the patient exactly what they need. They need to be adequately treated for their pain. They need to wake up accordingly, right? They need to be on the ball, on the money. You are controlling their life while they're going through surgery. I don't know why some people feel like they want it to be a walk in the park. It is hard as hell to get into nursing school. It is hard as hell to get into CRNA school. It is hard as hell to get into nurse practitioner school. These are not easy tasks, right? I went for acute care nurse practitioner. If you guys know anything about nurse practitioner, I thought there were some days I wanted to die. Literally thought about dropping out multiple times. The questions, the things they want me to be able to do, the things I have to be able to assess. Are you serious? That's how I used to feel. So I'm telling you guys that to say that when people say nursing school is hard, it's to remind you of how you have to bust your ass, right? You've got to study. You've got to prepare yourself adequately. Never to discourage, always to encourage. Make it your life. Right? You're going to meet your friends for lattes in the morning. You flip through your flashcards first, so you are prepared for class, right? If you are in school to be a nurse practitioner, they gave me a lot of online scenarios. If you didn't score good the first time on the scenario, do it again because you will have that scenario in the clinical setting, right? CRNA school is hard as hell. You got to study. You got to know these things, the formulas, the medications. I mean, I'm sure it's out of this world. Be prepared. Be prepared. Right? Just be prepared. Always to encourage, never to discourage. It's Alicia So Awesome. Bust your ass in nursing school, you guys. Whatever it is you're doing in the medical field, bust your ass. You are in charge of saving a whole life. Be driven. Be encouraged. Stay on top of things. It's Alicia So Awesome. I hope I encourage you guys. Any questions or concerns, please send me a message. And I'll see you soon.